Hi, my name is Christoph Bakula, and today, along with camerawoman Noelle Ceres and our patient Nicholas Fent, we will be demonstrating lumbar flexion goniometry. This is with help from Norkin and White's Measurement of Joint Motion book. The normal adult value for lumbar flexion, according to the AMA, is 60 degrees. The ligaments involved include the posterior longitudinal ligament, the ligamentum flavum, the supraspinous and interspinous ligaments, and the posterior fibers of the annulus pulposus of the intervertebral discs. These are the ligaments that will become stretched at the end of the motion. Lumbar flexion goniometry proves to be reliable in test psychometrics. A study by Nietzsche et al. Found an intra-class correlational coefficient of 0.92 and an inter-rater correlational coefficient of 0.84 for goniometry on back pain patients. As far as validity, a study by Natras and coworkers found that flexion range of motion measured with a goniometer demonstrated greater than 50% of the variance. Some of the contraindications for lumbar flexion include pregnancy, hip replacement, bulging discs, dislocation, fracture, spinal surgery, or spinal fusion. Now that we've gone through the background, let's get started. Hi Nicholas, how are you doing today?
Good, how are you?
Good. I've already washed my hands, so let's get started. Alright, are you okay with me putting my hands on you?
Yeah.
Alright, so first we're going to find the iliac crest, which is at the top of the hip bone, and this is where we're going to put the axis of our goniometer. So I'm going to start out on the hips, and then move up until I get the top of that hip bone. Alright, the next structures I'm going to look for are the ASIS and the PSIS. The ASIS is the bony structure poking out at the front of the hip bone, and the PSIS is the bony structure poking out at the back of the hip bone. And there they are. And these 2 points are going to be reference for where the stationary arm of the goniometer bisects. So I'm going to place the goniometer, the stationary arm bisecting the ASIS and PSIS, the axis on the iliac crest, and then the mobile arm is going to be bisecting, it's going to be at the mid-axillary line, so in the middle of the armpit. Alright, and now I'm just going to ask Nicholas to bend forward. Alright, so that is about 58 degrees, and that is close to normal. So that is lumbar flexion goniometry.